Hi Sarah, how are you doing today?
I'm doing all right. Doctor, how are you?
I'm doing well. So, what brings you in today?
Well, I've been having some jaw pain.
Oh, really? Can you tell me more about your jaw pain?
It happens most often when I'm like yawning or chewing really hard things, or like when I have to open my mouth wider. It really hurts, and it makes this really horrible noise.
Okay. When did this start?
It actually started quite a while ago, about '96, when after my ortho treatment finished. But it's kind of been getting worse, to me at least, since recently.
Okay, well, if you feel like it's been progressively getting worse, can you tell me on a scale from 1 to 10, with 1 being, no pain to little pain at all, and 10 being the worst pain imaginable, what's your pain like today?
Today I'd say it's about a 3.
A 3, okay. What do you think your pain would be on average?
I'd say right now that's about my average.
Okay.
So it's not really bad today.
Okay. And then what's the worst pain that you've ever experienced?
The worst one I'd say is like an 8. It really hurts.
Okay, all right. So what treatments have you tried?
I've just been doing stuff at home right now. So I have a hot pack that you warm up in the microwave, and I hold it around my face, and if that doesn't work, I take like aspirins to try to relieve the pain.
Okay. Have you seen any other providers for your jaw pain?
I went to my general dentist first, and he sent me to an oral surgeon and an orthodontist. And they both recommended I come see a TMD specialist.
Okay. Did they tell you anything when you went to see them?
They felt, based on what they knew, that it was an anterior disc displacement with reduction, but I don't know exactly what that means.
Okay. Well, we can try to figure out if I agree with them or not. I'm going to do a couple of things just to see if I can tell what's going on with your jaw.
Okay.
We're going to start off with a physical exam.
Okay.
Let me get some gloves on. Okay, so what I'm going to do is I'm going to be pushing on some areas on your face, and you're going to have to tell me whether or not you feel pain when I do that. So a 0 would be no pain at all, just pressure. And then a 3 would be like, ow, that hurts a lot, okay?
Okay.
So kind of on a scale from 0 to 3.
Okay.
So I'm just going to start right here.
No. 0. 0. That's like a 2. That's a 2 as well. I don't really feel anything back in that area.
Okay.
Maybe. No. No. 0.
Okay. So it seems like you're having most of your pain right in this area,
yeah.
Right? All right.
Yeah.
And now we're going to try to do some jaw movements to see if there's any popping or clicking, or if we can see what's going on.
Okay.
So why don't you go ahead and open? Okay, so I'm hearing a click when you open and when you close, but I'm not hearing any crepitus. Can you try to open again?
Okay.
So it doesn't sound like there's any bone grinding on bone going on, so it doesn't sound like it's a joint problem necessarily.
Okay.
But that's something that we can investigate a little bit further also.
Okay.
And then can you bite together? And then slide your teeth all the way to the right. Okay, and then slide your teeth back to normal. And then slide your teeth all the way to the left. Okay, and back to normal. And then can you protrude, stick your jaw forward? Okay. All right, and back to normal. All right, so it looks like when you're moving to the right, your jaw is not able to move very far. And with some further measurements, we'd be able to tell why that is and what's going on there. But it definitely looks like your jaw can move further when you move to the left than when you move to the right.
I can feel that, yeah.
Okay. So I would say that so far with just what we found today, I agree that you have an anterior disc displacement with reduction.
Okay.
I think we should get started with some kind of treatment right away. I would like to refer you for some further imaging studies before we get started, just to know exactly what we're looking at here. And then after we get the results from that, we can decide what treatments we should pursue from there. Does that sound okay?
That sounds great. Thank you.
Awesome. All right. Thanks.